Hi, I'm Eirik Salvesen from Årets Dental in Norway. I'll share some experience from the COVID-19 situation in Norway. For the reopening of the clinics, we needed to adapt different procedures, and we also needed to remake the inventory plan for the clinics. We cleaned up the waiting area. There's no magazines anymore, which some people are a little bit disappointed about, but we're keeping all clean surfaces. We also removed chairs where it was applicable, or we made a safe distance between the open seats that we're allowed to use in the waiting area. In addition to this, we are again asking the patients to be precise on time. Don't be ahead of your schedule, because we would like to get you straight into the treatment room and not by the waiting room. If it is applicable, we would also like you to wait outside of the room. As a patient is entering our clinic, the first thing they will be asked to do is disinfect their hands. So that will be available for everyone. As a principal, we're trying to get the patient straight into the treatment. By having that patient within the treatment room, we can control the amount of staff that will be entering the specific or be in contact with the specific patients. As the patients are arriving in the office, information is also given on the door. So signs on the door will always remind the patients on how to basically move around outside and inside of it.